Good afternoon, everyone. Myself, GARGEE DESHMUKH. I'm postgraduate resident in Amrita Hospital. I'm presenting a case, the straw that broke a camel's back. It's not moving. Move nahi kar raha hai. So it's a 50-year-old lady presented with a decrease in vision in left eye 2 weeks back. Her best corrected visual acuity was 6.6 in right and 6.9 in the left eye. Her anterior segment examination was normal. There were no cells and flares, and intraocular pressure was normal. So this is a fundus, right eye showing two subretinal orangish lesion, temporal, superotemporal and inferotemporal to the fovea, and left eye showing large subretinal creamish yellowish lesion, temporal to the disc, and there is a subretinal dark lesion which can be subretinal hemorrhage or RP atrophy. So moving to the OCT, right eye showed RP irregularity and RP thickening and slight elevation of the RP. Left eye showed subretinal creamy yellowish region through which we can see PED. On fundus fluorescence angiography, there is a stipple appearance in the stipple hyperfluorescence in the right eye. Left eye showed stipple hyperfluorescence and the window defect in the left eye. So we came to the differential diagnosis of CNVM, intraocular lymphoma and metastasis. ICG was done to rule out polyp. There was no evidence of polyp. So we gave, as patient was not willing for biopsy, we gave one injection of anti-VEGF in the left eye, which was bevacizumab. After which we followed up, and at 2 months of follow-up, she was having significant improvement was vision in the left eye, which was 6.6. So we did further investigation. Ultrasound abdomen was normal, PET CT was normal, chest X-ray was normal, and blood test for rule out other infections was normal. So 1 month after that, she came with a decrease in vision in right eye. Her vision in the right eye was 6.18, and she had fine KPs and 1+ cells and minimal vitritis in the left eye. And as we can see, there is a significant increase in subretinal creamish yellowish lesion in the right eye. So this is the picture showing increase in the subretinal creamish yellowish lesions in the right and left eye also. As we can see, there is a creamish yellowish lesion inferior to the arcade. So we did OCT. OCT in the right eye showed RP thickening with sub-RP material, and left eye also showed RP thickening. B-scan showed multifocal choroidal elevations, and we reached to the clinical diagnosis of primary vitreoretinal lymphoma. To rule out CNS involvement, we did MRI brain, and we also did CSF studies, which was normal. Further, after that, we did vitrectomy with subretinal fluid biopsy, and intravitreal methotrexate was given, and silicone oil was injected. So this is a picture showing 1 week follow-up. As we can see, there is a decrease in subretinal lesions. So pathology showed of the vitreous sample did not show any malignant cells, but subretinal fluid cytology showed atypical cells, high NC ratio, coarse chromatin, and it was positive for LCA, CD20 and PAX5 and negative for CD3, and Ki67 index was more than 80%, suggestive of malignancy. So this is a picture of pre-op and post-op 1 week. As we can, she has a improvement in the vision 6.9. So coming to the plan, if there is a one eye involvement, we do vitrectomy and we treat intraocular methotrexate or rituximab. If there is a bilateral involvement or brain involvement, we have to treat it with the chemotherapy and radiotherapy and systemic therapy. So this is a meta-analysis showing 19% patients who come with the intraocular lymphoma already have CNS involvement, and 58% will have CNS involvement over the course of time. So our patient received systemic chemotherapy and intravitreal chemotherapy. So highlights of my case are that if there is absence of AC cells or vitreous cells, negated the possibility of the inflammatory causes. Rapidity with which lesion showed in second eye showed it to be malignant process than neovascular process. And this is actually the first case of primary intraocular lymphoma in which intravitreal bevacizumab alone was shown the significant resolution. So intravitreal bevacizumab treatment for the intraocular lymphoma should be studied for further. Thank you.
Thank you, Dr. GARGEE. You've wound up well in time. Do we have any questions? Thank you. I think that was a great presentation. Thank you.